While standard treatment options for mesothelioma such as surgery, chemotherapy, and radiation remain the primary recommended approaches, some patients may also explore alternative and complementary treatments. These treatments are generally considered experimental and unproven for mesothelioma. Patients should discuss all treatment options thoroughly with their medical oncologist before deciding on a course of treatment. One alternative treatment approach is the use of targeted therapies that are being studied in clinical trials but are not yet approved for mesothelioma. Some examples include inhibitors of growth factors like vascular endothelial growth factor, VEGF, or epidermal growth factor receptor, EGFR. Bevacizumab, Avastin, is a VEGF inhibitor that has shown potential in early-stage clinical trials when combined with chemotherapy for mesothelioma. Erlotinib, Tarsva, and Gefitinib, Iressa, are EGFR inhibitors that are also being studied but have not proven effective as single agents for mesothelioma. Ongoing research continues to explore the potential role of molecularly targeted drugs like these. Immunotherapy is another area generating interest as a possible alternative treatment. Some immunotherapies work by helping the body's own immune system better recognize and attack cancer cells. Drugs called checkpoint inhibitors like pembrolizumab, Keytruda, and nivolumab, Opdivo, have shown promising results against other cancers and are under investigation for mesothelioma. Early results of clinical trials combining chemotherapy with immunotherapy agents are encouraging, but more research is still needed. Adoptive cell transfer using manipulated immune cells is another immunotherapeutic approach in early study. Nutrition and lifestyle modifications are frequently considered as complementary options by mesothelioma patients, though medical evidence of their effectiveness is limited. For example, some people choose a vegetarian or vegan diet very low in fat content in an attempt to starve cancer cells of nutrients. Others use antioxidant supplements or herbal remedies to try and boost the immune system or directly combat cancer growth. Despite a lack of proof these work against mesothelioma. Practices like yoga, tai chi, meditation and massage therapy are also utilized by some to help reduce stress. While unlikely to cure the cancer, lifestyle changes may provide psychological or quality of life benefits for some. Some mesothelioma patients explore unproven protocols that involve highly alkaline or antioxidant-rich regimens, high-dose intravenous vitamin C, or metabolic, ketogenic diets. These experimental approaches are not recommended as there is no scientific evidence they work against mesothelioma, and some put patients' health and conventional treatment at risk if not conducted under medical supervision. Traditional Chinese medicine, Ayurveda and other alternative medical systems also have treatments not proven effective for mesothelioma, such as herbal medicines, acupuncture, maxibustion or mind-body practices. While certain herbal remedies could theoretically boost immunity or reduce side effects through their antioxidant or anti-inflammatory properties, claims of mesothelioma cures through these methods lack evidence. Mainstream oncologists do not recommend replacing approved treatment with unproven alternatives. Experimental hyperthermia methods like infrared sauna therapy or targeted heat therapy delivered via specialized blankets or probes are also being researched preliminarily for mesothelioma. The idea is that raising body temperature may damage mesothelioma cells. While hyperthermia shows potential as a supplement to conventional therapies in early studies, as a standalone treatment its impact on mesothelioma remains unproven. Non-mainstream treatments like various energy therapies, oxygen therapies, non-toxic detox programs or the Gerson protocol also claim to cure cancer, but offer no scientific evidence to back up effectiveness against mesothelioma. The risk of delaying proven therapies while pursuing unproven alternatives means these approaches cannot be recommended. While promising experimental treatment strategies like targeted drugs or immunotherapies are under active investigation, no alternative or complementary options have replaced surgery, chemotherapy or radiation as the standard first-line therapies for mesothelioma based on current medical knowledge. Patients are encouraged to discuss all options openly with their oncology team, but pursuing unproven methods should not replace or delay effective treatments without scientific evidence to support their safety and efficacy against this disease. Ongoing research continues in hopes of finding new and better treatments for mesothelioma patients.